My name's Lorraine Haining. I'm partnership lead and specialist nurse practitioner, and I work for NHS Dumfries and Galloway. My project is called Ideas. We're a specialist stress and distress team working with people with dementia. I'm the only nurse in the team, and I work with lots of other specialists. So we've got psychology, occupational therapy, speech and language therapy and social work. And I think just the whole dynamic of that team is marvellous because we've learned so much from each other. Our team is about reducing the prescribing of antipsychotics, so we're looking at non-pharmacological approaches to stress and distress, and we're starting to see huge changes in prescribing habits, which is great for our patients. I think we started out with care homes, and now we've got a remit. Anybody can come and use our service. So what we tend to find in the training sessions, we can have a policeman, a fireman, somebody from home care, a social worker, a nurse from a hospital, a nurse from a community hospital, and that diversity in the room is fantastic because it really is great that people can share, their experiences and learn from each other. The other thing that I think we've done well with the project is we've looked at the evidence, and we've tried to gather evidence to show outcomes for patients and for staff, and I think that really helps people to understand, that you are making a difference. An example particularly worked with myself was an old lady in a care home. They'd asked us to come in and provide some expertise around it. The lady had been quite distressed. She kept pushing her call bell constantly throughout the day and night, and was kept shouting for help all the time, and they had tried bringing her into the lounge, but she couldn't settle there and put her back to room, and it was difficult for them to provide that one-to-one all the time for her, and we went in, and through the process, the pathway that we use, we actually recognised that the lady was in actually quite severe pain. But she was also very depressed, and we picked it up through the gathering of the information and the observations. We got the pain treated and we got the depression treated, and within 3 weeks she was like a different person. And I think there as well, the difference that we made for staff was that they didn't have a real understanding about depression in older people, and it was quite an eye-opener for them to think that that's what was wrong with her. So we ended up doing some education with the staff around depression in older people. So I think there was a win for everybody in that situation. I think there's just so many places to go with what we've done. We've had a lot, as far as we're aware, we're the only team in the country like the team that we are. We've had so much interest in Scotland from lots of other health boards. I think we've had 9 health boards in Scotland who've been in touch with us asking to meet up with us, or we've done video links, and they're looking to develop something similar in their own area. And we've also had a couple of trusts in England who've been in touch as well, because they've heard of the work that we've done. So I think, I hope it spreads. For me, I just want to see that the work spreading, and I want it to be embedded into practice, and sustained. I think that's the thing for me now. That's the challenge that we've got, is we've got it working, but we need to keep at it, to make sure it's sustainable and that it continues to be there.